Deputy Maureen O'Sullivan is the next question, and you have 30 seconds to introduce the question.
My question, Minister, is in relation to the CE drug schemes, the particular schemes, and it's a subject that we have discussed already, and you've met some of them, I know. And my question is arising from the particular issues and problems that some of the projects in the North Inner City, North East and North West Inner City have brought to my attention regarding the schemes.
Minister.
Deputy, I'm pleased to say that considerable progress has been made in increasing the number of participants on the community employment drug rehabilitation schemes. A key first step in securing this improvement was the establishment of a stakeholder group with the Department of Social Protection, which now assists the Department to identify and implement enhancements to the scheme. In addition, workshops have been held with the scheme supervisors and the departmental staff to ensure that the schemes meet the needs of participants. To complement these changes, an improved vacancy notification system and referral process was introduced. In January of 2012, when the schemes came over, as it were, to the Department of Social Protection, 578 drug rehabilitation places were filled, actually a very disappointing amount, as I said at the time. This increased substantially by the end of December 2013 to 590 places. In addition, there are now 161 support workers, giving a total of 951 places dedicated to drugs rehabilitation on CE. And as you know, those places are ring-fenced, and that is a very significant increase, which I think has been welcomed by the communities and the various schemes that I have had a chance to visit. There were 23 available places advertised on the jobsireland.ie website on the 22nd of January of this year. The annual turnover on the scheme is just about 400 places. During any given year, participants can exit for many reasons, including illness or relapse, gaining employment, maternity leave, retirement, emigration, transferring to another scheme, or exit to a training programme or to full-time education, or exhaustion of CE participation limits. Data on the age profile of participants and participation duration I've attached in tables to the reply.
Thank you.
All CE referred drug rehabilitation participants are eligible for 3 years duration. In exceptional circumstances, I have said there's provision for an extension of the duration on a mainstream CE project, subject to the Department agreeing that with the scheme.
The rest of the reply will appear in the official report. Deputy O'Sullivan.
Yeah, and I will have a look at the reply in full, but the reality is that the projects are experiencing difficulties on both referrals and extensions. For example, one project would tell me that there's a waiting time to get on a scheme. Somebody applied the 9th of January, it will be the end of January. Now, on the normal scheme of things, that's fine, but this is somebody who's coming out of residential rehab. They need to get on a scheme much, much quicker. On the other hand, what's happening is people are being referred to the schemes and they're not ready for them. What these projects are seeing is they're getting a younger, a less stable, a less ready for work and training cohort who are applying to the scheme. And sometimes it seems to be just get the numbers off one register and get them onto CE, regardless of whether they're ready for that and can get really full value from it. Projects have told me that it can sometimes take up to 9 months to settle somebody who has been active in addiction coming onto a CE scheme. It can take even longer at times, so therefore their time can run out on that scheme before they're ready to go on to the next stage. Some may have used that CE time on another project, maybe for stabilisation or whatever. Then they come on to one that's offering FETAC accredited courses. They may not have the time there to finish that qualification. There are travel costs with some of them because some projects are taking people from all over the city.
Thank you,
now, some of those have their City of Dublin, the ETB one, so why can they not get a student card to cover some of the travel costs? And there are issues with childcare as well.
I come back to Deputy O'Sullivan. Minister.
Thanks, Deputy. As you said, the drug rehabilitation scheme plays an important role in helping recovering drug users to develop their personal and employment skills. As Minister, I have, if you like, provided for a duration of up to 3 years. It's quite a long journey, and it's a journey that can be a very difficult journey for some people. So we have endeavoured to make it flexible. And in addition to the 3 years, there's a provision for a further extension of the duration on a mainstream CE project. And in that case, what we would look for, if it's extended duration beyond 3 years, we would look to see that there was a serious educational, developmental complement, so that, for instance, the person would achieve certification and qualification, because if they were then seeking to get work, that would be very important. The other issue then would be to find, not just within the scheme itself, but in terms of follow-on work experience for people, because in my experience, people who have been involved long time in an addiction situation and an addiction problem, they very often lack any recent work experience, and that is a very big barrier to even when they've got clean and they've rehabbed and so on, if they don't have the work experience as well as the education, it's quite difficult for them to go on and get further employment.
Thank you, Minister. Deputy O'Sullivan.
There's also a major issue for those who are coming directly out of prison and being referred to a scheme. But I think what the Minister is saying is not filtering down to the officials sometimes. And it's the officials that the projects are dealing with, and they're getting a different answer from the officials. I think there's another point, which is about how do you measure success and progression. And in terms of the officials, it is getting into education and getting into work. But for somebody who has been in addiction, just even staying clean and sober is progress. Getting their children out of care is progress. Getting visiting rights to their children is progress. Not going back into prison is also progress. And really what the point I'm making is that I think the projects need a lot more flexibility, because most of the people I know working on these projects are working their 10, 20, even longer years. They know all of the issues. And just wanted to point a Gateway project, who would love you to visit to see some of these issues on the ground. They're getting 9.8% of their annual training budget from your department. But that's only 9.8%, but they have an inordinate amount of administration work for that amount, and it's taking them from other work on the project.
Minister, final reply.
Well, as I said, when the department took over these schemes in early 2012, because unfortunately I myself would have long experience of people who've built up addiction problems and then their long journey to rehabilitate, which is not important just for their family, but for themselves, but hugely important for their families and their children. And I was a bit taken aback at the low level of take-up on the schemes before the schemes came over to the department. So we've set up a stakeholders forum, and what I would suggest, and I appreciate the information that the Deputy has given now, is that perhaps these specific issues can be taken to the stakeholders forum, because many of the people involved in addiction who then get clean and rehab, it's a long journey, but very often involvement in education as opposed just to training is really important, because, for instance, some of them go on, as you know, to train themselves to become counsellors and go on to third level and so on. So I'd certainly be interested in hearing, and so would the staff of the department be, in specific issues that you think have arisen, because we ring-fence the places and we have made a specific provision for a time extension in particular cases, but in those particular cases I would like to see a strong educational developmental content.
Thank you. Go on to the next.